For more on this, we are joined by Dr. Abdulrehman. He is a consulting and clinical psychologist. He is also the director of clinical psychology of Manitoba, and he joins us from Winnipeg today. Thank you so much for taking the time. This incident, Rehman, has had a huge toll on so many people in different parts of the country on different levels. Let's start, if you will, with the families of these victims. What are they going through right now?
Well, instances like this have a high propensity to produce not just grief, but in many instances post-traumatic stress disorder, people who have witnessed that, vicarious traumatization, which can have a very strong and long-term impact on people's mental health.
So given that and this very traumatic event, how should or how can the families, perhaps, who are watching this program or who are at home trying to come to terms with what's happened, what kinds of things could they be doing? I hesitate to say should because it's so different for so many people, but what sort of things could they be doing?
Well, social support is a very critical preventative factor for many mental illnesses. So making sure that we're talking to people, talking about how we feel, sharing our feelings, even talking about our fears that come from this. When we talk about our feelings, when we are more communicative with our social supports, it not only shifts the way that we think about things and actually turns what we're thinking into a verifiable object, so to speak, a thought, a sentence we can reconstruct and challenge and get support on, but it also makes us feel supported. At a time when crisis can leave us feeling alone, it is very critical that we feel supported and together with other people. So those are things that people can do right off the hop.
What about first responders? Because they have a unique role here because they were on the scene, presumably adrenaline pumping right off the bat, doing the job they need to do. But now, we often talk about PTSD. So how might they be approaching things?
Well, and so I work with first responders, and in particular the RCMP, and I can tell you that, most RCMP members actually go into work mode when this happens, and it's after they've managed their job that they feel the impacts of these events. And though that, what we're seeing is one large event, first responders are actually dealing with numerous events that are equally as bad on a regular basis, and that starts to wear away at their mental health. If you think about the coating on a wire, so to speak, that gets worn away if you don't have that protective coating, and people are more likely to experience trauma. Now, the good thing is that our first responders do have access, particularly the RCMP have access to psychological support that most of the general public don't, and that's helpful for them to be able to access health. One of the things that stands in the way of that is usually a culture of assuming that we can walk off our mental health. And that's not something we can do in this case. This is a clinical issue. This is an operational stress injury, and it's important that they get.
Okay, and we will, of course, watch for that. But then there's, of course, the survivors, Raymond, because they themselves will naturally be going through quite a lot. Perhaps you could talk to us about what sort of mental health challenges may emerge as they are released from hospital and have to come to terms with what's happened.
Well, we'd be looking at a variety of trauma-related illnesses when it comes to mental health, and that could range from a variety of anxiety disorders to mood disorders, but most commonly some form of, adjustment disorder or post-traumatic stress disorder. The challenge is that those individuals do not have access to psychological services the same way that our first responders do. And so, how they deal with it would be, they could certainly seek out those services. We have a significant shortage of psychologists, not just in the province, but across the country. We don't have a public mental health care system. So that's where the challenge is. And I think shows like yours that talk about this and help disseminate information on how to address mental health can be, almost a public health initiative that allows people to know what to do.
So let's dig into that a little bit, of course, because you just said, as you mentioned, mental health supports across Canada, but also Manitoba, in short supply, this big event here. Where can people in Manitoba go if right now they are in need of mental health support?
Well, I think it's really important to differentiate between what that is. And there's a variety. In the same way in medicine, we have a variety of professionals. We have nurses, we have physicians, we have a variety of physicians, we have emergency staff. In mental health, we have a variety of professionals as well, too. We have social workers, we have counselors. We have psychiatrists and we have psychologists. And ultimately, in this case, what we need is somebody who can actually both diagnose a problem, because we need to be able to differentiate. It's what some people might just see as somebody suffering through grief and sadness may actually be, in fact, post-traumatic stress or adjustment disorder. So we need somebody who can diagnose, but then we also need behavioral interventions as well too, that don't just address it through a medication, which in some cases may mask the symptoms, but actually ultimately treat it. And psychologists are the individuals that actually, the professionals that do that job, but we don't have access to them. If people are lucky enough to have, an insurance program, they can try to seek that out. But as I said, there is a shortage, and so most clinics, particularly in Manitoba, are turning away people because psychologists themselves are overrun and overworked, particularly post-pandemic.
Well, we have to leave it there for now. Thank you so much for your insights today. Dr. Abdulrehman is a consulting and clinical psychologist in Winnipeg.